came back positive. This time last week, the weekly percent positivity was 18.9%. So we are seeing quite a significant increase in the number of COVID-19 cases that are screening positive for a variant of concern. With that, I'm now going to turn it over to Dr. Williams for further comments.
Okay, well, thank you, Dr. Yaffe. I want to take this opportunity to acknowledge and celebrate International Women's Day. And this year has shown how critical and what a huge load that women have taken part in leading the fight against COVID-19. I'm grateful for their incredible contributions as we work to this end, to end this pandemic. And I know that besides my staff who are here with supporting me, I'd be remiss if I didn't mention other women like my wife and my 3 daughters who are all in frontline healthcare work who have done a great part contributing to this. And let alone my staff who are here today supporting me, I'd be remiss in not mentioning that some of the brightest minds I've worked with, many of them in my area, are in fact our women. And not the least who is Dr. Barbara Yaffe, who's here with me today. So thank you to these remarkable women and they're supporting the province's pandemic response and shouldering the many burdens that have come to them in this past year. Many different levels and many different challenges over a year. And this has not been easy and it has been challenging and many have risen to the occasion and stepped up even beyond expectation. With our public health, with the framework, all 34 health units have now moved into the framework as of midnight last night. And based on the general improvements in the trend key indicators, we have moved some, such as North Bay and Parry Sound is now in the red control level. Toronto Public Health and Peel are also making progress, even if their numbers were tending up a little bit in the last few days, but their case rates still remain high, and they're in the framework at the gray lockdown level. And we'll continue to review their data on a week-by-week basis. While all the regions have returned to the framework, everyone must remain vigilant to help prevent further increases in transmission. As you've seen by our data, leaving out the data entry error, which was a bit concerning, especially this morning, to see that we're over 1,600. I'm pleased to say that it probably wasn't that. But it means that our numbers over the weekend did not stay below 1,000. We went up well into the 1,200 and 1,300 level. So we are in this phase where the model is saying we could be trending back up again. And we have seen, as Dr. Yaffe has already alluded to, that our variants of concern are taking up more and more of a percentage of the cases day by day, getting well up to 35%. So our concerns are there, our need to remain vigilant, because I do feel that no matter where we are in the framework, if we do personally what we're supposed to do, which applies to all levels of the framework, the masking, staying within your household, going out and doing non-essential visits, less than possible, I mean visits to retailers or places that might be open, that might be available in your framework, you shouldn't go unless you really need to go. I know for some that was much of a social activity in the past. I'd really discourage that at this time strongly, because you don't want to risk exposure, especially to the variants of concern, that it doesn't take much to happen. And we've seen some cases where we've watched some outbreaks recently where the period of incubation with the variants of concern had been reduced to from 5 to 7, down to 2 to 3 days. So it shows you how quickly and with a small amount of viral infection, you can pick it up and become a case in a very short order. So you have to be very vigilant on doing your personal behavior, whether you're in the gray or even down in the green. Because if you want to keep your area in that level, everybody has to do their part. Or as we've seen before, the numbers can escalate very quickly, even in the green and yellow zones, up to high levels and move you back into red and lockdown zones in a very short order if we're going to try and keep these variants of concern under control, because we're in a race against time here. As they're rising, we are getting more vaccines. We are stepping up on the vaccination numbers. We want to vaccinate as quickly as we can, as many as we can, to try and protect as many as we can in the process. But that will take time. We're moving through that in as quickly as we get the vaccines in and out again, and involving more and more sectors through our public health units. And we hope to bring in others, as you've heard already, with our pharmacies and areas, expanding that and going soon to our primary care healthcare providers as well. So if we just hold and be firm and be careful for the next number of weeks ahead, we can keep this, even the variants, I believe, under control, bending the curve from being that rapid rise, not like the hockey stick that Dr. Brown talked about, but there's sense that it will go up, but we like to make sure that it's not too much and not to compromise our healthcare system. And it's really been encouraging for the last few days. We've seen that we've had no deaths reported in our long-term care homes or retirement homes. The vaccine is having a huge effect as we complete that process. So that's all happening, and lots of optimism in there, but we have to do it. We have to stay at the task until that time comes, and we will be prepared for that. And that'll be great when we face that issue when we have the large percentage of our population vaccinated. So those are my comments there. So over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Cynthia Mulligan at City News.
Hi, doctors. I know that you said that you did test and found roughly 31% are variants of concern. Is that your overall feeling of where they are? And could you give me a sense of what you actually think the true number of variants is and where it's going from here? Past modeling showed that if it hit 40, cases could really explode.
Well, yes. Well, thank you. And what we're doing, we're trying to say that with the amount of testing, and unlike some provinces, our numbers are staying up. So we're still doing a large volume, as Dr. Yaffe's already alluded to, even on the weekend. So people are still coming forward. All those positive tests, even up our 11, 12, and 1,300, today 1,600 probably by a data entry delay, means that we're getting 50 to 60,000 people quite a few days coming forward for testing. This is not an insignificant amount. And as I've had some people say, oh, there's so many people still coming forward to get tested. It's good that we're doing that. We're actually moving out more other tests too with some screening tests. So we're looking further and wider to find any positives. Why is that important? Because any of those positives that come back through our testing is taken and vetted through our 501 mutation PCR testing. These are the numbers we're talking about, these percents. And what percent of those cases every day that's getting ran through, how many are positive? So we're confident that the ones we know about that are coming through and people have come forward and gotten tested, that percent is reflecting. It's not like real time because, as you remember, before when the people get a test, it takes a day or two to get the sample into the lab. It takes a day or so to get that in, then enter it onto our database. So there's a time delay. And the same as then you have to add 2 or 3 more days to get the PCR variant done and that data entry. So you have to understand that when we say 33% is back a few days ago and how to analyze that. So I know that's adding a bit more of a complication, but that's just part of the logic process. So it's as real as we can be, allowing for the timelines delay in the tests and the data reporting and recording in our systems. But it's up to date as far as those in that context.
Follow-up?
Okay, so when I explain that to people on the news this evening, should I say, right now you're finding 31.2% coming back as positive for variant, but the number could be higher because this is a few days in the past, and do you see it accelerating quickly?
There's merit in saying that. At the same time, it could actually be lower. We just don't know yet. We've had where we go up to 33 and then back down to 29 and back up to 31. So it varies day by day because it isn't a smooth process. It depends on who shows up and where they're coming to get tested in that. So I would say you have to just go on with the data that we have at that stage and watch it because you're looking at more of the trends over time. Day by day, it'll fluctuate, and I wouldn't get too caught up on what is each day, but overall, what is the 7-day rolling average, and we try to give that data to you as well to make up for the timelines as well as the day-to-day variation depending on who came forward to get tested and which day.
Next question.
From Jack Howan, Queen's Park Briefing.
Hi, Dr. Williams. I was just wondering, in your opinion, does the resumption of residential evictions increase the risk of a third wave?
I'm sorry, I missed all that. Residential?
Evictions.
Evictions.
As all the stay-at-home orders are lifted now.
Well, it is a matter that I know that our different sectors of the government that are dealing with those issues are addressing and trying to look at. It is a thing that I know it has concern for our cabinet members on how to deal with this issue. We would like to work at isolation in many ways if it's not, because some people may have circumstances that they can't isolate in a let's say a multi-generational setting, and can we get some alternatives for that? So we're working on those as well. So the key factor is that if they can't isolate, we'd like to help them try and find some way to isolate in a way that's reasonable and meeting all the needs that they have for the time period. So that could contribute in some way, but we want to make sure we can help in that situation to ensure the proper adherence to the protocols and guidelines.
Follow up?
And I was wondering what your advice has been regarding evictions. Is this something that that should continue to be paused for the foreseeable future or for the near future?
My recommendation has always been whatever helps people to stay and to maintain their isolation capacity and do what they need to do is important. If that's one feature, but there may be others out and beyond that one that may be important to consider as well. I try to allude there, not just the eviction, but there may be certain living situations that makes it impossible for them to isolate properly, and how do we help them in that situation. So again, the key thing is stopping spread, and those that have been identified as cases to have them isolate away from other members of that they know, their friends and partners and family in the timelines, so that they avoid spreading the infection, because they don't want to do that either. So there's many features and components in there. They're all important.
Next question.
From Randy Rapp, CHCH TV.
Hi, doctors. The CDC today issued guidelines saying that people that have been fully vaccinated can gather without masking and without social distancing. Do you agree with that advice? Once somebody has both doses of the vaccine, are they okay to hang out with other people that have also had both doses of the vaccine?
Thanks for that question. Yes, I have seen the advice from CDC Atlanta. Of course, they have a much higher percentage of the population vaccinated, so that is an important consideration in that making that recommendation. We are obviously at this point working very hard to get people vaccinated, and we do have a pretty good level right now in long-term care and retirement homes, which is great, and Operation Health Immunity. But other than that, we really are nowhere near what the CDC is recommending at this point in Ontario. But we work obviously very closely with Public Health Ontario on looking at what can we make, what difference can we make, what kind of conditions can we put in place for somebody who has been fully immunized. But the bottom line is everybody needs to keep doing the basic precautions we've talked about for now.
Follow up?
And we have a unique situation in Ontario in that we're going to have people going with one shot of the vaccination for presumably the rest of the summer. 4 months is what you've said. What is life going to look like with one vaccination? Is it going to remain the same as it is now? Or are we going to continue with, most areas in some form of lockdown?
So you're asking, these are the questions that we're looking at right now and how we will apply that, because you're correct. We're going to be deferring the second dose for up to 4 months, especially with our mRNA vaccines in there, because we want the maximum protection. What we want to know, and we haven't had any evidence yet clearly, does the vaccination in the 1 on the 2 dose, especially even in the parts with the USA, does that negate any transmission of virus at all? That is still being worked out now as we're going to do some ongoing testing. So this is evolving science. We know it protects against contracting and the severe sequelae or consequence of the disease in there, but we're not sure it actually eliminates total transmission altogether. So, so when you ask people to say, well, you can just congregate any way you want, you've assumed at that stage that there's no transmission will occur. And I'd like to think that would be the case, but I still want to see the data. And I still understand in population measures, as you carried out in various countries like the UK and the US, that, as Dr. Yaffe's already alluded to, are further ahead with large populations done. Some are not up to levels of 70 to 75% of the population totally vaccinated with two vaccinations. That's the protocol. And then, of course, they're going to have the complication of adding new vaccines, such as the Johnson & Johnson with just the one dose. So there's going to be a number of things to put in there with advice and direction. So again, we're going to ask people to remain tuned to messages we're going to give out as we understand it better, and we have the evidence to support any directions and policies that you've asked about.
Next question.
From Heather Butts at CTV National News.
Hi, I'd just like to follow up on that question about the CDC guidelines. I'd like to get one of the doctor's opinion on those recommendations. Is it too soon to be offering up recommendations such as that for those who have been vaccinated?
I mean, I think the CDC is very well respected, and they look at the data, and I'm sure they have put together some evidence to bolster their position. I think that they have a much higher rate of vaccination, and they have a different circumstance. But, certainly we're always interested in looking at the data that they've used and seeing how we can apply it here once we get more vaccine into people. I'm sure Dr. Williams will add.
Well, that's true. And when we get data and information from other centers, even renowned centers, we would like to take it through our scientific advisors, as in Public Health Ontario, and our scientific table. We did it already with some previous advice from CDC Atlanta on masking, and we vetted it through our experts. So we're not that we disavow that. We would like to look at it and see how that applies in our context within our country, our jurisdiction, and see if that is supported by our scientific advisors and experts. So we'll take that to them again as well.
Next question.
From Jeff Gray at the Globe and Mail.
Oh, hi, thanks. I wanted to ask just about the variants again, being at 31 or thereabouts. It seems like they're going up about 5% a week. I think last week we were talking about them being at 25. And you mentioned the race against time. Can you give us a sense of where the finish line is in that race against time? Where are we? How fast are we looking at these things growing, and when does the danger zone kick in?
So the race against time, what we're trying to do is to get the most vulnerable vaccinated as soon as we can. And so the variants, because they're high transmission rate, and we've seen that already, unfortunately, in a congregate setting outbreak, and it had, unfortunately, a fair amount of mortality related to that. So our vulnerable populations are prone to that, and if it spreads very rapidly, would be exposed much more quicker to the variants. So our idea is that we're now moving into getting the over 80s done out in the community. We want to move as soon as we can. I know General Hillier and the task force would like to, with vaccine volumes permitting, to get through our phase 1 to move to phase 2 in full force as much as we can to get more and more of those vulnerable numbers done. If we can continue doing that while we try and slow down, because you remember the modelers were saying that our variants of concern, especially at this phase early of March, would be doubling about every week, and you've alluded to that. It wasn't doubling, but you're being optimistic, saying it's only going up 5% a week. That would be better for me. It was 5% rather than going from 20 to 40% already by now, which it didn't. So I would take that as encouraging. If we can slow that down, and so that instead of doubling every week, it would maybe doubling every 10 to 12 or 14 days, which would be a success of our ongoing public health measures. That's one reason why we're being very cautious and reluctant to move quickly to opening everything up too soon, because we've seen that impact of that in other jurisdictions. So we're trying to keep that as best we can under control and slow that rise and doubling of the variants while we try as quickly as we can to get those vulnerable populations and as many Ontarians vaccinated as soon as possible. But you remember, even after you vaccinate, it doesn't have maximum effect until about 2 or 3 weeks at least after the primary vaccination. So we need time to get that done.
Follow-up?
Is there a threshold where you would have to look at going to another stay-at-home or a gray plus, or tightening things for the Toronto and Peel and places like that if the variants continue to grow quickly?
Well, because we're in the framework, if your numbers in your area, whether you're in green, yellow, or orange, or whatever, if they keep rising up and go beyond those numbers, you'll be in the gray lockdown. So that's in there. Stay at home would require a different type of legislation that the framework does not involve, yet all our recommendations are to stay at home anyways and to do those things there. So we don't have to wait for that. If your numbers in your jurisdiction accrue to that level, we will be moving up, and a number of the health units, as you will notice in the framework changes at midnight last night, a number of them moved up. Some went right from yellow to red because how fast it was accruing. And that's one of the things with the variants where it would slowly move up, well, relatively slowly, every week or 2 weeks. Now we see it, sometimes it goes up 2 levels in a matter of a week because it's that rapid and it spreads that easily. So we have to be careful. We have to be vigilant. And if you want to keep your area in the color zone, everybody has to do their part.
Last question.
Holly Mackenzie-Suter at the Canadian Press.
Hi, I just wanted to ask about adding pregnant people to phase 2 for prioritization in the vaccine rollout. Can you explain kind of the science and the thought behind making that change?
You or me?
You go.
All along, we've been making sure that as each vaccine comes out, sometimes in the initial approval, there is some precaution with some early studies around some individuals such as pregnancy, immunocompromised, and others. And we wait for that further evidence and science as each company through their monograph on that and with clinical trials goes through that assessment. So once we understand that that's okay, and of course that we would like in some cases where if there is a pregnancy, as we go into phase 2 in that level there, we're hoping that more and more we'll be able to equip our primary care physicians with the capacity to give that vaccination, or those looking after the women in their prenatal conditions, that they would want to have that discussion with their doctor and to get the right recommendation they would like to have, or to be equipped with that when they go to a mass vaccination clinic. Because we find a lot have questions because there's a lot of information. Some of it's good and some of it's not so good that's flowing out there, and you want to have that information received for you from a trusted source to say, one of this one, now we have 3 going to 4 vaccines, we could go to 5, and which one should I get, when should I get it, where should I go to get it? All those things need to be answered. And I think any mother who is expecting would want to make sure they had the best information they had and trusted information and resource. That tends to be their primary care provider, whether it be a physician or a nurse practitioner in that, and sometimes in their midwifery services as well. So we want to make sure that that's carried out. So we're trying to put that into our phase 2. And again, some of those actually may be essential workers and involved in other levels. So they're not, just because you're pregnant doesn't mean you're not in other phase 1 classifications. You may be there already. And so that's a reality in that. So I would say that's the answer I would give at this stage. Be advised what you need to do, when you need to get it, and talk to the sources you want to have, because you want to be confident in that decision making.
Follow up, and this is the last question.
Thank you. I remember about a month ago, we heard that screening for the common mutation in the 3 variants of concern was going to be happening on every positive test. Is that actually happening? And if not, can you explain why?
Actually, every positive test in Ontario currently is sent for testing for the 501Y mutation. And those that test positive for the mutation are then undergo whole genome sequencing to determine which of the variants of concern the case is. So yes, they are all sent for that kind of testing at this point.
Thanks, everyone.